Hello all. Today we have Dr. Ruhi with us, and she's a doctor entrepreneur. She has done multiple, like she has multiple startups into functional medicine, and it's bootstrapped. All of them are bootstrapped. So today we will try to understand how, as a doctor, she's been able to create multiple online ventures into medicine only, and that too completely bootstrapped. So in today's journey, we'll go through how her journey was, how did she start the whole thing, and uh, currently what exactly do they do, and how does she manage the team and other. So, okay. So, hello, Ruhi. Welcome to our podcast.
Yeah, thanks, Shivam. Thank you.
Great. So, like I said, Ruhi, before we start, now can you give us a little bit brief about what is functional medicine? Like, what does your organization do?
Sure. So, functional medicine is not just another field of medicine. Okay, like we have allopathy, we have homeopathy, we have Ayurveda, we have Unani. So, functional medicine is not another field. It's an approach to look at a problem or at a health problem. Okay, which gives you the perspective of looking at a health problem through a root cause approach. So basically, why this person has these signs and symptoms? There must be some reasons behind it. There must be some triggers, some root causes. Functional medicine enables a practitioner to identify those root causes and then come up with solutions to address those root causes.
Okay, great. And tell me a little bit about your organization also. Look, I know that you run a couple of them, so like whichever you like, or if you want to talk about all of them also. So,
So the name of my company is Functional Medicine Institute. So that's the main organization, and under that we have different verticals, different brands. Where Functional Medicine Clinic was the first one that we started off with, and that's our consulting, consulting brand, where we offer consultations, various subscription programs, which are based on the functional medicine approach. And then we have another one which is called the Hormone Reset, where again we use functional medicine along with yogic principles, traditional Indian wisdom, to bring a wonderful program for women health. Then we have a diagnostic vertical, which is called the FM Diagnostics or the Functional Medicine Diagnostics, where we have brought advanced functional tests from around the world on one platform. And then we have FM Nutrition, which is a marketplace for quality supplements, functional food. Now you may be wondering that why did we have to create so many different things? Why did we just focus on functional medicine clinic? When we venture into something which is so new, right? I want to do consulting, but then when I want to get people do test, it's not available. I want them to use certain supplements which are either not optimally dosed, or they are just too expensive if I have to get them from abroad. So we need an ecosystem where we can have all these things available. Of course, I cannot do everything, but then whatever was possible within our bandwidth, we tried to create that. And then, of course, there are a lot more other partners here in the ecosystem, a lot more brands, companies that have come up which are supporting this, fueling into this ecosystem. And yes, while we created this, because functional medicine was so new in India when we started, there was a need for a society where all functional medicine practitioners could come on board. So we created Indian Association of Functional Medicine, which is amazing how it has grown over the last 3 years, where we have almost like more than 120 functional medicine practitioners as members of IFM.
wow, that's very nice. And matlab, maybe if you can talk a little bit about who are your like who what are the kind of people who approach you, or in terms of your patients, or what are the kind of treatments, like ailment for which people come for treatment. So that will give people a little bit perspective of who comes to you.
Sure. See, today there is so much information available online, right? So I'll just give you an example. If I experience indigestion, right, immediately I will Google what can be the reasons of indigestion and all that things, and all that is being flooded. The information largely, if you see, it's about, okay, you can take an antacid, you can maybe, all those things which is just very regularly commonly advised in the conventional system. But then people are also becoming a lot more aware that there can be things beyond just drugs. And that's when you start looking for alternative ways of how that can be addressed. So today, people who are coming to us are all these people, largely one who have kind of done a lot of doctor hopping, and they have not found a solution anywhere, and they come to us as the last resort. They have been chronically sick because of digestive issues or because of an autoimmune condition. They are struggling with thyroid disorders for years, have been on medication, diabetes, BP, again on medications for a long time. So basically, either they have been on medications and they don't want to continue taking medications, or none of the medications have ever worked for them, and they're really finding a solution to get back that life. And the third is children, parents of children who are on the spectrum.
Great, great, great. So, so that is about like the current organization. So let's go back to your journey. And so, can you tell us briefly about how was your childhood, like where were you brought up, and did you always wanted to do this, or this happened like, on the go?
I had no clue when I was growing up, or when I was in my high school. So I come from a very small town. It's called Siliguri. It's in West Bengal, and like I am. So we are five sisters and one brother, so a big family. And my father was very keen to make me a doctor. Probably I was not so keen, but he was very sure that he wants me to be a doctor. And I tried my best to get a medical seat in India, but unfortunately I could not. And it was his plan to send me abroad to do my medical degree. And I would give him all the credit for kind of embarking me on this journey where I could travel the world and get so much of exposure, learn about so many things which probably I may not have could not have done if I was still there in Siliguri, right? Because the opportunities were not much in that small town. So after my medical schooling, when I came back to India and started working in a hospital, I realized this is not what I want to do, because all I was doing is I'm seeing patients in the hospital and giving them few drugs just to kind of help them reduce the symptoms. That's all. There was nothing about lasting health. It was just about symptomatic care. And for me, it was like, I cannot, I want to do it, I want to create an impact, but not at such small level. So I worked for a year in a hospital, and then I decided to kind of, find what my real calling was. And I decided to move on to the preventive side of health. So where I can
Well,
actually,
I'll stop you here. I think we're going with fast. So maybe like a little bit more about like so during your childhood, did you ever think that you would be doing some sort of entrepreneur stint, or like did you see anything like any leadership trait that you thought would lead to this?
no, see, I am like, my father is a businessman, and if I see my extended family, everybody has a business. Nobody ever did a job, right? Nobody was in a service.
And
And
what kind of business were they doing? Like what was your father into?
yeah, so my father, he had a transport business. So he had trucks, and then it was transporting goods, and then he was also into trading. So this was largely the family.
And were you the elder one in the family, or like how did you the doctor thing come to you?
I am not the eldest one. I am the third of the siblings, and I'm the only doctor in the family. So I mean, it was completely, I would say, not normal for me becoming a doctor in a family, where everybody has always been in business. And when it came to girls, it was mostly like they completed their bachelor's or a master's. That's all. Nobody really went for a professional degree like a medical course. But what I've always seen growing up, is other business dealings, right? Whether it's my father, whether it's my uh, everyone, right? So that's something that I've always seen. And one thing was also that it was never a lavish life for us. It was always very mediocre, where we always kind of and it was, every small thing was valued a lot. So and things never came easy. At least for me, it never came easy. So I think all that really helped later in my journey of entrepreneurship, and a lot of things that I've done later in life.
Mhm. And like, so when you were getting into your medical school also, so like, so was there any inclination towards functional medicine at that time, or it was a regular medical course, or how was it?
It was a very regular medical school. Functional medicine was not known anywhere. So I started my medical school in 2004, and I graduated in 2010. Functional medicine, I came to know about functional medicine a lot later. So it's like, yeah, it's amazing how eventually functional medicine came into the picture. But then when I started my school, my higher studies, and even my first jobs, functional medicine was nowhere.
So when you like after you did your medical school, generally what were your peers like? Were all of them coming back to India and practicing? Or
Yes. Yeah. So that's like the normal, right? You come back to India, and then you have to clear a registration exam in India so that you are eligible to practice in India. So all of us did that, and then started working in the hospital. Some of them, later they went into government jobs, government medical jobs, but everybody was into clinical practice. There was no deviation from the clinical practice. Somebody is doing a master's in, someone is doing a master in orthopedics, or someone eye specialist, gut, something or the other, but everybody is in core clinical practice.
wow. So and when this thing like you start feeling that okay, I'm doing very regular, then and then you went for masters, or like did you go masters just after your bachelor?
So just after my bachelor's, after a year of um, job experience, where again my job experience was not something that I wanted to continue doing, so I chose a master's in global health, which was again very different from the public health masters which was available in India then. The masters in public health is very traditional in India. uh, I had the opportunity to get into a master's in global health course in the Netherlands, which was a very advanced course in public health.
And like and after once you come like generally what do people do after they do like masters in public health or global health?
So after that, again, when I decided to go for that master's, my plan was I will finish my master's in global health, and then I will work for organizations. I'll try to get into organizations like WHO, or one of the United Nations organizations. That was the picture in my mind. And great, I got into the master's. The program was amazing. Not So it was all about how you can develop programs, you can develop innovations from the bottom up approach. Rather than you create something and give it to people, you first understand what people actually need, and then you design them, you develop them, and then you implement them. So that and my specialization in the program was on implementing innovations on a global scale. So by the time I completed my master's, my 1 year back, 1 year ago, what I thought I'll get into I'll try to get into WHO or a United Nations organization. That was not no longer my plan. I didn't want to again get into that bureaucratic system. I wanted to now develop innovations for people which are impactful. And the program gave me a lot of exposure in different parts of the country as well. So my program was in the Netherlands, and then I went for an internship in Kenya, where it was actually in the slum. I was interviewing mothers in the slum, trying to understand their perspective about malaria, right, which is so common in Africa. In Kenya, it's so common. And it was amazing to get the insights from them, where again, the way health programs are designed for malaria in Africa, they fail to understand why these programs are not working. I'll just give you a very simple example. All the health programs in Africa are focused on educating mothers why they should be uh, giving certain medications for malaria to their children. And during my interviews with these mothers, I could find out that actually the mothers very well know that, when is the child getting sick? What are the signs of malaria? They're aware of everything. It's the father who does not know about it. And then when the mother has to take the child to the hospital, the mother does not have that autonomy. It's the father who takes the decision. So
Wow.
the programs have to be rather focused on educating fathers about, what is needed to be done for malaria rather than everything on mothers.
Nice. And so, and this was a 2 year course or like a what?
It was a
Like,
1 year course. It was a 1 year very intense course.
wait, so did you come back after that, or like how was it?
Yeah. So I applied for jobs there, and I got into one of the startups there, where again, it was a very interesting startup. They were making products for elderly care. And I was the first foreigner to be hired by the Dutch company. They only had Dutch team members. Um, the founder, I mean, he was very innovative. He always thought out of the box. And I just happened, he gave me a car during one of the sessions we had in the university. And after my course got over, I went and met him over a coffee, and then he was just a 30-minute conversation ended up, for a 2.5 hour interview. And well, he was like, I'll take you on board. I don't have a position right now, but I will try to create one which where you fit in with your skill set, your background. And finally I was there in that startup, where I was involved more on the research side, um, which could help in new product development. And I worked there for 2 years. Yeah, that was quite interesting. And a lot of exposure when it came to really design innovations from the bottom up approach.
Mhm, mhm. Then how did the next move happen?
Yeah, so now by the time I finished 2 years with that startup, if I look back, it was almost like 10 years out of India. And it was almost like, okay, now it's time to return to India and bring back all the knowledge, all the experience back to the country and do something for, people out there. And during this journey there, I had my own diagnosis of PCOS, for which I was looking for answers. And the only answer I could get was get on hormonal pills. And I was shocked that, okay, is that the only solution for if you have PCOS? There can definitely be better ways to address this. It took me some time, a lot of reading and everything. So I returned back to India, and I started working here with again I worked with startups because that had always excited me. I loved the kind of culture startups had compared to really big organizations where you're lost in, you know, creating the impact you want to create. But in startups, you can really do a lot. So I worked with a lot of startups here in India, and while working with them, I was also looking for answers for my own health journey. And I came across clinical nutrition then, which focused on really understanding how nutrition can uh, create so much of health benefits, which was never a part of the medical curriculum. And it's quite shocking that in a medical course, there's so less focus on nutrition, which again is so important, right? It's always overlooked. It's all about drugs, it's all about this and that, but not about nutrition. So that really excited me, and also gave me few answers, but yes, not all the answers for my own health. But yeah, I did find a couple of answers, and I started applying them. And with that came the genesis of my first startup, which is called Dr. Juice. And it's a healthy food line that we started off in Bangalore. What we did there was cold pressed juices. The recipes were all designed by us for different health conditions, for different benefits. Everything is served fresh, nothing is pre-packaged. So cold pressed juices, vegan shakes, there was no concept of vegan shakes. It was always about milkshakes everywhere. So we brought in vegan shakes which were made from fresh coconut milk. And then there were millet based salads. So everything made fresh. And just before COVID, we had like 8 outlets across in Bangalore. And it was really doing very well.
Wow.
And so that was about how nutrition can really
So
bring such.
when did you start this Dr. Juice?
So we started Dr. Juice in 2018.
Oh, like 10 years before COVID, almost. Uh,
Yes, yeah.
nice. And like, how did you scale it to 8 stores? Like, was it franchise stores or own stores, or how did that
All
happen?
it was all own stores, and we started off with one, and then slowly we got into cloud kitchens.
Mhm.
So actual outlets we had only two, and then
Mhm.
the remaining six were all cloud kitchen. So very lean model, and we were doing great until just before, and even during COVID, we were doing very good. But I think during the later part of COVID, that's when businesses like Dr. Juice were affected a lot, and we had to cut down the stores.
Mhm. So, and you started this while you were working at the startup, or by then you had left the startup?
You mean where I was working?
Yes, yes, yes. You said that after you had.
That always went hand in hand. I was always working with healthcare innovations while I also created on my own startups. So I think I had that benefit, that freedom with the startups that I was working with.
Wow. And like, how difficult was it to start Dr. Juice like that? Because that's now you have to manage people who, like, probably some shifts, you have to want to manage logistics and other things. So how did all that happen?
Yeah, so now all this was from scratch. Like myself, and my other two co-founders, another so second was a doctor, the third was a business guy. None of us have done any cooking, or we have experience of hotel, nothing. So the recipes were all designed by us. We did a lot of experimentation ourselves in our kitchen to come up with the best combinations, etc. Every day we were tasting juices and finalizing, okay, this will go well. And we tried the salads. So everything was, kind of, it was homegrown. So we did the experimentation in our kitchen, and then we brought it to the Dr. Juice outlet. And yes, we did not hire trained chefs. It was, we hired smart people, hardworking people, trained them how to do it. And that's how we started. And this has been our um One of the things that we've always focused on during our hiring process until now, that we look for people who have certain core values and certain skill set, and then we can always train them in the right direction.
Nice. So when you were doing this Dr. Juice, how much time did it take you to start your first outlet after you have decided that there's something that you want to do?
So it took us 4 months with all the
Really?
planning and finding a place, branding,
And
finding
how
people.
much did you invest initially into this?
Uh yeah, I think we started off somewhere with 5 lakhs for the first outlet, first Dr. Juice outlet.
Mm. And by the time, like COVID, before COVID, when the business was doing well, what was the turnover that you were doing? Like, if you can tell.
Uh I'm not very good with the numbers, because my other
What you
partner,
said, you said,
yeah, he was handling. But then we were the businesses on a daily basis. I think our sale was really good. We never had loss on a
oh,
single
so you
day.
were always, yeah,
Yes, yeah. So we were doing very well with all the 8 outlets. Yes, one outlet can always have less sale compared to the other, but then it was always kind of, we were not in losses.
wow, nice. Nice. So how did the next step happen after that?
So while we did Dr. Juice, one thing we also realized that providing healthy stuff is good, but then are people aware? There was still a lack of awareness around that. So building that, creating that awareness was very important, and that's where something more was needed beyond just selling healthy food or healthy drinks. And then COVID happened. So COVID basically made everyone homebound. So initially, I was doing a lot of traveling around for work with a startup that I was working with. Now, nothing, no travel was there, right? So I had a lot of time to read, and so my other co-founder is my husband. So both of us, we spent a lot of time reading, right, about diseases, and again beyond nutrition as well. So, and that's what brought us to functional medicine when we were looking for tools, kind of to create awareness or create the right kind of information, etc. We came across functional medicine, and then it was like, okay, this is what we have been looking for. Now, here are the tools we can use for creating awareness, for creating the impact that we have always wanted to do. So during COVID, I think it was a lot of reading, it was a lot of talking also. We did a lot of webinars because people were also looking for information. COVID was a time where people were looking for good information. So we did a lot of webinars also, which had which had very good response. And I remember 2019 August, I created the Facebook page for Functional Medicine Clinic. We didn't have any designers, we didn't had any social media person, we didn't have the funds to do that either. So I created the Facebook page of Functional Medicine Clinic, and just started posting few posts. If you go back on that page, and you'll see our very initial posts were very basic, right? It would just have a background, just the name of the disease, but the caption was always very nice. The caption had a lot of information where we would get a lot of engagement.
Got it.
And I remember, I myself, I was running the ads then. I would place the ads, either boost a post, or, that's what I mean. So, with no background of any marketing or anything, we started everything from scratch.
Wow, nice. So around August 2019 was the first time you started figuring out that functional medicine is something that you would want to go with.
Yes.
Right? So and you said that initially you would do webinars. So how would like how did the first webinar happen, or how did like you said that you created the Facebook page, but before the Facebook page, what was happening? Like how did you guys decide that now like we are really ready to go for this kind of thing.
So even when we made the Facebook page, we were not sure that we were ready to go.
Hmm.
So we made the Facebook page. We started sharing content because we were not sure that would people pay for this.
Hmm.
We want to help people reverse diseases, but are people ready to pay us for this? Or they are just happy to listen and then, okay, fine, thank you. It was good information. So we were not sure are people ready to pay us. So we were running ads, we were spending money, we were doing free consultations. And during those free consultations, we understood a lot about um, human nature when it came to diseases, right? What are they looking for? What are their pain points, right? What kind of solution they're looking for? So a lot of these consultations that we did, right, during the COVID, again, this was not about COVID consultation. This was about the chronic diseases that people are struggling with. So that helped us a lot in designing the programs, designing our offerings the way it should be done, so that we are really able to touch the pain points, we are able to address what people are struggling with.
And so, like when you started your functional medicine thing, like what was your expectation that what would happen? Like what like do you have any clarity? You know how would this look like? Maybe or where do you, how do you want it to shape up?
So when we started off, and we would say that we are an online clinic, no, most of the people would not trust us. They're like, you don't have a physical center. No, we don't have. No, I will only consult if you have a center, you have a office, and we will come and see you. So, and we didn't have an office, right? We could not hire, we could not rent out a space for the business then. So most of them, many of them would not believe us, and we were like, fine. We kept trying, we kept trying. Some of them did believe us, and uh, during COVID and later during COVID, people were okay with online consultations. Then this concern of, okay, you are only online, this stopped. And post COVID, I think people have very well accepted this entire online model, right?
Mhm.
And with Dr. Juice, which was a heavy investment business that we did, right, where you require good amount of funds to set up one outlet. Even if it's a cloud kitchen, it's investment heavy. So one thing we realized that with functional medicine, if we have to grow this venture, we cannot make it investment heavy. It has to be a very lean model, right, where we have to kind of cut down all the frills. We have to run on minimum cost with which we can still deliver the best. And I think the online model worked very well. Initially, it was only me and Ashwini, it was a two-man army. We were doing everything, whether it's scheduling a call, whether it's doing a call, whether it's, making a treatment plan, sending up everything. We were like just soaked in work all the time.
Wow.
So that's how we worked in our initial days of functional medicine clinic.
Wow. And like how many years were you married by the time you were doing this?
So we were married for 4 years then.
Okay, okay. Because if it's early years of marriage, then like it's a little more tense, right? Because you're still getting used to each other. Or did you figure out that those years brought the best out of you, both of you?
So I knew him for 10 years before we got married.
Mm-hmm.
So of course, but I would still say that it's never enough to know a person, right? Um, every day you get to know each other more. And when you're working together in a business, I think you see all different uh, faces of that person, right? So it's a completely different experience.
Right, right.
um, but yes, I think it was a lot of learning together, and we have created a lot of businesses together, and yeah.
So how was your like who was your first patient, if you remember, and how did he or she come in?
So again, she came through one of the ads, and
Mhm.
we did a free consultation. And initially, we were not very sure, should we charge this much or should we charge less? Maybe if we charge, if we tell them that you have to pay this, they may say that, it's just too high, because there was no comparison to what we were doing. We could not see, okay, this is what the market charges, and we can charge this much. So there was no such benchmark for us. So everything we had to really come up with whatever we want to keep the price tag, everything. So yes, our initial patient, and
So
I
what
still
was the ailment, if you remember?
Yeah, so
How was
she had come to us with some gut issues and body pain, where she had been struggling with that for quite some time. Again, visited many doctors and everything, but did not find any relief. And
Mhm.
then we did our protocol. We got the test that would help us understand the root causes. And then, yeah, we made a functional medicine based protocol for her, the diet, the lifestyle changes, um, supplements. Then whatever we could find on Amazon. Again, we did not it was not very clear whether the quality is good or not, right? But we tried to identify the best ones based on review and the manufacturers, etc. And in 3 months she made amazing improvement.
Nice.
So individuals like her, who were our first clients, they of course gave a um, lot of motivation to us, and kind of helped us keep going.
Nice. So once you got your first patient, then how did things shape up from there? Like, so until what level did you reach before you start thinking of, shall we build a team, or like this is something that's working out?
Yeah, so when we had initial 50 cases, right? We did 50 initial cases. When it started growing beyond that, we felt the need for someone who can, kind of take care of some operations and sending out mails, all those things. So we got someone to handle a part of operations. And then we also started off with some group programs for autism, for learning disorders. That's where we were working with a lot of children. And again, as we were growing, then that's when we did our first hiring of a clinical team. And then that
Right.
was
So
another thing.
can you also talk about the timelines? For example, you started in August. So when
Yes.
did the first 50 happen? When did, like, which month were you in?
So we started in August 2019, which was just before COVID, right? COVID, I think, had hit in
No,
March, April.
COVID. Yeah, yeah, just after COVID, I think. Yeah, yeah.
Yeah, so 2019 was before COVID, right?
Yeah,
And
okay.
yes, so
Uh,
COVID had hit in 2020,
mhm,
somewhere in mid. So COVID, the entire COVID year was, nothing much had happened,
mhm.
because people were not going out. People were, kind of struggling with basics, right? Just saving their lives. So chronic disease was not something they were looking into. But that was still the time we had run our ads, and we did a lot of consultations. I think that helped us prepare the ground that we wanted to work on. And it took us, I would say, from 2019 till it took us a year to get our first 50 patients.
Okay, so around August 2020.
Yes, yeah, it took us that time. Uh, Again, because people had other priorities to spend on, and not on kind of reversing chronic conditions.
Just to go a step back, right? You started before COVID, and but then you were already running a successful juice brand. So why did this thought of, let's do this also? Because people get so engrossed in one business that it becomes difficult for them to. So how did this happen? The second one.
Yeah, so as I said, just before COVID, we were doing very well with Dr. Juice. And then the COVID happened, which made us kind of, shut down on some of our outlets. So
But
we had
it
to,
happened in 2020, and you started FMC in 2019.
yes.
So you started while you were doing Dr. Juice also.
Yes, yeah. So again, when Dr. Juice was more outlet based, right? So we didn't,
Mhm.
we ourselves didn't have to go and sit in the, in these outlets. They were running, right? They had to be managed. While we were kind of, the mastermind, we had started it off, but then on day to day work, it's not that we had to be involved completely in that, right?
And like
And
see, a lot of operations heavy business have this issue that you have people issues, you have a lot of other issues, and running 8 stores is definitely a nightmare. So
yeah.
how did you ensure that you both didn't have to involve into any of
So,
this?
my third co-founder, right, who was from the business side, yeah, so that he handled all the operational part of Dr. Juice, and so he took care of all of that.
And how did you find a great co-founder like that?
See, all right. So I'll tell you how. So I was one. Um, Ashwini, who's my husband, he's the second founder. Now both of us, we are good with kind of the technical, the clinical side, or what has to go in and everything, but we are not good with operations, right? I mean, or the business side. So the third co-founder who came in was my brother.
Okay.
Okay, he is the business guy.
So how was like what was he doing? Like how did he happen to join eBay?
So he's an investment advisor, right? So he had
Mhm.
his own advisory where he was providing advice on wealth management, right? So that's what he was doing. And then when we told him about this venture that we wanted to start, he was excited. So it was like, now we need you on board. We have this plan, and we need your help to execute this.
Wow. Great. So, wow. Well, that's very nice because see, generally operations business are so difficult, right?
Yes,
On
yeah.
the ground, they are a
Yeah,
nightmare.
so so I think without his help we would not have been able to kind of execute this.
Great. Yeah. So once you started SMC, now 1 year has happened, the patients have happened. Then what happened?
So that's then we registered the startup.
Oh, okay, nice. Yeah.
Until then it was just a Facebook page. So the Facebook page happened in August 2019, and 3-4 months later I designed the website on Wix. Okay,
Wow.
pulled a template and designed it so that we can get started with some online bookings, etc. And then September 2020, we registered our startup. Yeah, and it's 4 years now, almost four and a half years since we registered the startup. And yeah, and
So when
it's
was the first hiring? Like, like when did you hire your first person in this?
for operations, we hired soon after we registered. We started hiring for small um, basic roles like operations. Yeah, our
Mm,
clinical hiring started off a year later.
okay, okay. And so how do you like? How did you structure the like you said that with Doctor Juice you got someone who could do the operations for you. Over here, how did this process happen?
So in functional medicine clinic, it was a lot, um, you know, information driven, right? Where it was all coming from the medical side. Still it was medical, but at the same time it was not the conventional medical, right? So of course, having that background of medicine helped us a lot, but then again, thinking and understanding from the functional medicine perspective was another thing. So of course we had to get ourselves trained in functional medicine to really get that learning. And then, so when I told you, right, when we started hiring, we cannot find people who are trained in functional medicine, right? Because it's just so new in India. Okay, we cannot find people who are doctors trained in functional medicine. We cannot find people who have worked in functional medicine startups, operations of functional medicine startups, right? So we were clear in that we will hire people who are hardworking, who are dedicated, and who are willing to learn. These are the three things I want, right? If we see that, and also they can associate themselves um, with the vision that we have, right? We want to create an impact, right? We didn't create functional medicine clinic because we wanted to make money, right?
Mhm.
We we had our own jobs, we were doing well, this was not needed. We were not satisfied with what we were doing, and that's what made us create functional medicine clinic. So that was clear, we want to create an impact, money will follow, right? um, and I think all the each and every member in our team, right from day one that we have got, um, I'm very fortunate that we had right people join us who believed in the vision and the mission that we in whatever we are doing.
Mhm. So but see, you set these goals that we want this kind of person, but then finding the person is the challenge that most startups struggle
Challenge.
with.
Yes, it's a challenge, and all the hiring I have done myself. And I think LinkedIn was very useful in that sense. I would post the jobs there. I would get a lot of people apply for jobs, and I had my own filter to just turn off, reject certain profiles. So I have done a lot of interviews, a lot. I mean, it's crazy how much time I have done, and I really wonder sometime that an HR manager has a difficult job.
To take it. And see, you have so and once you started hiring people, see, because and I'm assuming that currently you have a decent size of people working with
Yes,
you.
yes.
And then you like for all these people you have to set up HR processes and a lot of other things, right? So how did you go about setting those things also, right? Or like once you started having more people, like what kind of things you had to do to ensure that you could retain them?
See, we first started with the basic processes, right? Everybody wants to have um, kind of one thing was very important, that it cannot be a 24/7 job. We need to have clarity on the work timings, right? So that was very clear. You are off after 7 p.m. You're off. You don't even have to check your message, and nobody's going to tell you why you have not reverted. So that was very clear. The login and the logout hours. Um, the salary will always be on time. That's important, and respect for the team members. That's very important. So. Uh, these were the basics that we ensured when we started off, that we have to respect each team member, we have to respect their time and the value that they bring in to our team. um, and then of course, as we grew with passing time, more and more processes and everything, we are still setting up all the processes, and my operations team has been upskilled to handle certain tasks, etc. So it's not like we have hired experts in our team. We have
Mhm.
we 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 tried our best to hire right people who can do this role, and then we upskilled them, because we were not in that position where we can hire people who have worked for 5 years, 10 years in a certain role. We were, as a startup, we were not in that position to do that.
And how, like, have you faced this issue of attrition, or like that has not been an issue for you?
So far, if I have to see people who left, we had one designer who left because he wanted to help his brother with a startup. You know, he with his brother, he wanted to do a startup. That's when he left. Another one of our doctors left because she was moving abroad. Um, yeah. So far,
Mhm.
yeah, that's only been the people who have left.
Wow, that's amazing.
Yes,
The,
but we had two of our doctors who left very early, and I'm very happy they left very early, right? Because they could not, they didn't feel that this functional medicine was a right fit for them. And I'm
Mhm.
very happy that they left early because they did not, feel that it was a right fit, because otherwise you've invested so much time. And
Mhm.
definitely functional medicine space is not the space where you work without a motivation. You
Mhm.
have to be very dedicated, you have to be very passionate about what you're doing, and that, only then you'll be able to bring the outcome in your clients.
Wow. And like you said that you had to train your team a lot.
Yeah.
So, and how did you like have you formalized the training now, or like is it still both of you giving the trainings, or now how does it happen as you're growing the organization?
For our doctors, for a team of
Yeah, yeah,
doctors,
yeah, yeah, yeah.
from day one it's hands on.
Oh, okay.
So any doctor who joins us, they, for the first 6 months, it's a kind of internship.
Mhm.
And but while you are getting trained, you also have to handle cases.
Mhm.
So because it's so intensive, it's now each of our team member is working from home, right? It's work from home, but you have to be as dedicated as you would be if you're working in an office.
Mhm.
And we are very fortunate to have amazing team members in our team who are so committed. And in terms of training, yeah, we start day one on training on cases, handling cases, so that you learn from day one. You don't have to wait for 2 3 months to start handling the cases. So you learn with the other team members who are handling the cases, you join them. So yeah.
And like, see, like I'm assuming that these doctors who are coming and working with you, they could very well go to other hospitals also. So, like, and so how do you how is still able to attract good talent in your organization?
So Shivam, I think um, that's quite an important question, because yes, all the doctors that whom we have who are working with us, they can very well work with you know hospitals where they have already done. They have been in clinics, but then again, that's not what they wanted to continue doing. So they definitely wanted to switch, and now the switch is either then you get into a non-clinical role, right? And when you have been into clinics, you do not want to go into a non-clinical role. Okay, you still want to work in the clinic, but then maybe not in a clinical setting, like in a hospital. So then the model, like, where you have an online model of functional medicine clinic, where you are still very doing very core clinical work, you're handling clients, you're working remotely, but then it's a completely clinical role, right? And you're able to deliver and create an impact which you were otherwise not doing in your previous role. So here you are learning a complete different science, right? You are upgrading your knowledge, you are upskilling yourself, and you're seeing a better outcome in your clients that you're handling. So one is that satisfaction, and then at the same time you're still able to continue on your clinical journey, and the professional growth is huge.
So then they get to learn a lot more as
Yeah.
compared to.
Yes, and here I would also want to add that myself and Ashwini, we never shied away from training our team. What we know, we have always tried to teach our team. Many practitioners, they don't want to share the knowledge with the rest of the team, right? But here we always wanted our team to know what we have learned, and that has always been our thought process, that we want our team to know as much as we are knowing. As we get to learn, we want to teach to our team. So I think that's also something where our team also sees the value, that the kind of training, the kind of information that they also get to know, which otherwise you're doing something which is very mechanical. You don't see a
Mhm.
professional growth in what you're doing.
Mhm. So do you have any formal training mechanisms, like do you do sort of like weekly trainings, or like how do you formalize this whole thing, ensuring that this happens the right way?
So of course, when we started off, it was not organized training, right? It was a more like on a daily basis, you're learning on the cases. And then kind of we were doing short sessions where we would give a lot of information to our team, and then as time passed by, we made it more organized. We started having more clinical sessions on a bi-weekly basis, where we had um, different topics to learn about. And then we also launched a course where then where then the team got into a formal training. But then by the time they got into this formal training, they'd already learned enough from the clinical experience.
Wow. Nice. So there's one thing I think a lot of companies also like they want to train their people, but then at some point there are so many people who are joining in that like if you take someone midway, right, you don't know whether to start like from scratch for him. So does it always have also happen that uh, there are other people in the team now who are training, or like it's just still the both of you who do that?
See, the first 6 months are definitely training and they're learning. Once they've crossed 6 months, then you see a difference in the way they're handling cases, the way they're speaking to the clients. All that is different. And then with more and more clients that they handle, a lot of confidence builds in, right? And then we would also oversee the calls that they are doing. We would also kind of join the calls to see, and all that monitoring would also happen.
Wow. Right. So is it like completely doctors then, or do you have some managers also now, or how's the structure?
So our clinical teams are completely doctors. For our operations, we have operations manager, we have our accounts manager, so we have a sales team. So now all that bifurcation has happened.
Wow. So do you like you are the CEO, or like what role do you hold currently?
So I may not have a formal CEO position. I have not put that formally, but yes, yeah, I do pretty much what a CEO has to do.
Okay. So who are your direct reportees, and like how many direct reportees do you have?
So I have the operations team who report to me directly, and then of course the sales team does, and the clinical team largely works under my co-founder Dr. Ashwini. He kind of manages the clinical team, and wherever my support is needed, I support them, but largely more on the operations, the sales, the processes, all that I oversee, and of course marketing.
Wow. That's really nice. And to give me a rough number, like how many people would be there in the organization currently?
So we are now 32.
Wow. Very nice.
Yeah.
And
So
in almost like you started in 19 to almost 5 years, and
yeah, in 5 years, we have grown to a team of
yeah,
32.
it's very nice. And wow. And had you like if I was to take an equivalent of this in a physical clinic setup, right?
Yes.
So how big would a hospital be having a 32 staff, right? Matlab, just to visualize what am I looking at? Yeah.
So if you're talking about a hospital, see,
Or
it's
maybe
very.
some like give me some reference so that I can visualize what like because online 32 staff and like
See, I'm
in,
not sure if comparing to a hospital would be a right comparison, but let's say if we have to compare it with another startup where people are physically present in the office, right? So you can imagine if you need, I have 12 doctors on my team right now, right? So you can definitely imagine, and all these doctors have to do calls, etc, right? So you need to have decent space where each one has it cannot be a call center kind of setup where one person is hearing what the other person is calling, right?
yeah,
it
yeah, yeah.
Yeah, so you can imagine the kind of space that would be needed so that they can conveniently do the calls without an interruption. And then
Mhm.
you need space for the sales team to do their calls, to reply to the inbound calls, the outgoing calls that they have to do. The operations team is, I mean, I think we would need
Very good. Because, yeah,
amount.
if I just have to imagine like a hospital having 12 doctors cubicle, that's a lot of
Yes.
that's pretty big because you need so many people sitting in that hospital too. right? And that's
Absolutely.
good.
Yeah. And then there is so much also then required on a daily basis to maintain that space and kind of cater to the needs when everybody's in the office.
Wow, very nice. And so, how does it like? What's next? Like, how do you visualize things changing going forward?
So over the last 5 years, I think when as I said, we started off only with functional medicine clinic, right? And then we saw, and we had just one program that we were offering, which was a 3-month comprehensive program. Then we launched the learning disorders program, which is for children who have autism or ADHD, etc. And uh, then we also introduced Hormone Reset, which is again a very unique program, which we do together with Siddharth, and beautiful outcomes there. So we also have grown in our program offerings. Okay, and then as I said, we also needed an ecosystem. So we created FM Diagnostics, and now over the last 1 year we have FM Nutrition, where we have quality supplements, one of its kind, available not just for our clients but also for the other practitioners in the country. um, so now next that we are also working on, of course, one thing that we always wanted to do is, we didn't want functional medicine to be an alternative medicine. Of course now people look at it as an alternative medicine, but then we have to make it mainstream. It's not an easy task, but then if I make it a premium offering, it cannot become mainstream. I cannot bring it to people. I cannot bring it in every household if I make it a premium service, right? So we priced it very optimally so that people can afford. And the idea is now to reach to more and more people, bring it to every household. Um, just functional medicine clinic cannot do this alone, so we need many more practitioners. And hence we are also working on creating a program, a training program. We already have a basic program for training, but we are working on a very elaborate program for functional medicine training.
Great. And like, see, an organization like, especially someone who's working in healthcare, right? So you've seen that uh, this is a very regulated industry also. The government has a lot of regulation. So have you faced any challenges, or like how has your journey been around that? Or did you
See,
intentionally take some choices so that you didn't have to go into those codes?
definitely, I think when you're telling that you can help in reversal, right, you're already shutting down certain businesses. Okay. So yes, that's always there. But then we have our intentions right, and we are not over claiming. What we are claiming, we are able to deliver. And yeah, I think whatever we are doing is very well our within our limits, and what we can do in our uh, capacity. So I think that's pretty okay so far.
Yeah. And amongst the two of you, like who's the one like who makes the decision that this is our vision, or like is it a shared vision, or is it like let's take it one day at a time and figure out what's happening?
So of course it's a shared vision. We both have our strengths and weaknesses. Um, so when it comes to creating kind of building partnerships and all that, Ashwini is very good with that. And when it comes to, so he innovates, right? And then so he's like, he throws an idea, and then now to grow that idea is now my job.
Oh, nice, nice. So that's a very good differentiation of the like into activities. That's
Yeah.
nice. And so if someone has to like start something similar, or maybe like if you were to do this whole thing again, right? Matlab, what are some things that you think you could have avoided or you could have done better in the past?
So, Shivam, I actually don't have any regrets. If I
Mhm.
see from where we started off, I think we have come a long, long way. We never had any structured guideline or any template to pick up from any other businesses. We never had a sales playbook to start off with. Okay,
Mhm.
so we never had theories which we could directly apply in our business.
Mhm.
Whatever we did was from scratch, was from our learning. Okay,
Mhm.
so I think we are very glad that we did it that way. Okay, we had our own learnings. Yes, we not everything worked out, right?
Right.
But I think it's good to learn, um, and keep learning from our mistakes as well. Otherwise we will never try anything new.
So maybe I'll rephrase my question. So, what are some things you wish you knew that then you and if you would have known, things would have been much faster for
So now, given that we are completely online, right, um, and it's all about information and how that information is being delivered, right? I may have amazing information to give, but then if I'm not able to package it in the way people want to hear, I may not able to reach out to the population that I may want to do. So yes, that's where having some background understanding of marketing definitely, I think, really helps businesses like ours, where if we had from the beginning, if we had somebody from our team who had that marketing acumen, I think we could have achieved things faster than what how we have achieved today.
you. Mhm. Right. And another thing is like, can you tell me that were there some hypotheses with which you started and they didn't they were too wrong or they went right?
um yes, there were. For example, when it came to pricing, etc. Right, what ticket size should the programs be? We were like, people may not be willing to pay this price, right? But then when we started off, yes, people were willing to pay that. So yes, there were certain hypotheses which also kind of turned wrong, and at the same time there were also certain hypotheses with regard to pricing itself which turned right also.
Mhm. And while you were doing all this, like you have built a team, you have built now multiple businesses, and you have learned everything on the go. So do you think that but you have again you worked with startups also.
Mhm.
So do you think anything that you could have learned a little bit early or would have would any formal training would have helped you in terms of doing things better?
um See, when I started off in this journey of entrepreneurship, I had that's when I would think that maybe doing an MBA would be good. Okay, but then I never did an MBA, and then over the period of time, when I met various other entrepreneurs in this journey who had MBA and I interacted with them, I didn't feel the need then that, okay, I don't have a formal degree in MBA and then I'm not able to do what I could do with the startup. So I think you can see it this way. Because I didn't have any formal degree in business training, I did it my way, learning from the experiences and actually from the grassroots level experiences.
Like, so like now we are nearing towards the end of it. So if again maybe if it's okay, can we discuss the marketing part of it?
Sure.
So, like you have so many people, so many doctors. So, how do you ensure that they are like you have a continuous reach of patients who are coming to you, or make sure that they are fully utilized at all times?
Okay. So I actually never, so both myself and Ashri, we never thought this way that our team should always be occupied all the time. So what we have always thought in a way that um, we have to, because see, the the amount of suffering today is a lot. Whether you talk about gut issues or thyroid, every household has someone who has a thyroid condition, right? Every household has someone who's struggling with the constipation or gut issues, etc. The autism cases are rising, right? So when there are so many, when there's so much suffering out there, and we know that we can bring out, we can help these people. That's what drove us to, okay, now how do we now reach out to those people? And so one thing is, we do a lot of workshops, and these are online workshops where again the intention is information sharing. And here it's not about, okay, let's do a workshop so that we will then make conversions or kind of make people enroll. The whole idea, the intent is to help people understand the concept, help them understand how, if they have an autoimmune condition, for example, how can they identify the root causes, how can they recover and achieve lasting health. So the intention is very clear. It's about creating a lot of information and sharing out them. So we do these workshops, webinars. Our social media pages always have a lot of information. And I think that also helps in a lot of transparent brand building where the intent is right.
So what are the different channels that you use currently for people to be aware about your solution?
So YouTube is, of course, one. Um, of course, I think we still haven't been able to fully utilize it. We are trying our best. Then Facebook, Instagram is another where we keep sharing a series of posts on different health conditions and also about the solution. Um, LinkedIn, yes. So these are the main channels that we use.
Okay. And have you like so I'm assuming that your website ranks high for a lot of towns. So like how did you make sure like what effort goes into it, and how do you make sure that you are able to appear in the right searches for your kind of services?
So I think that that's where the skill set of team like yours come in. And as I said, we ourselves do not have any marketing, or SEO background. And so that's where experts like yours come in, which help in setting the right target audience, and kind of so that our messages reach out to the right target audience, and we are able to really appear in searches for the relevant people.
Mhm, mhm. Got it. And like see, because as the organization grows, your awareness should increase. So have you given a thought to like would you go about doing formal PRs also in future, or that is not something that you have considered so far?
See, I think that's definitely that helps, in terms of the kind of reach that you can have if you use a formal PR. But I think that also comes at a cost. So that's in our plan. But for now, definitely when it comes to PR, uh, we are more looking into organic PR that can happen, and the paid ones can come later once we are geared for that.
That's nice. And like any plans of raising funds, or like have you guys now started raising something?
Yeah, so we are bootstrapped for now, and when it comes to raising funds, we don't want to just raise funds and be stuck, because the moment you raise funds, and if you do not have the right investors, your mission and vision gets diluted. It becomes more about numbers than numbers then, right? You have to achieve this numbers, and you have, I mean, the whole focus is diverted, and then we lose the vision we started off with. So again, we do want to raise funds then, but then we want to raise it from the right strategic investors who kind of can have them also vested in the vision, and the impact that we want to create. We don't want to take money for the sake of taking it. uh, yeah, I mean, so far we have been bootstrapped and we have been going very well. um, yes, funds will help us scale up a lot, and do a lot of things faster, but then we don't want to compromise on our quality of work and the delivery that we are doing.
And have you considered now, since you have a larger organization, and you said that a lot of people you hire are more for intent purposes, but then like we hear from a lot of founders that there's so much that a founders can do, and at some point you have to have a formal people taking over things. So do you, and we see that these days a lot of clinics, big larger hospitals are also very professionally managed. So do you think that at some point you would be looking at that angle also, or you think that internal talent could take care of all those things in future?
So in my opinion, what we have also been focusing on is setting the processes, right? So we don't want to grow without having the basic framework right. So right now we are working a lot on setting all the processes, right? Whether it's about onboarding a client or whether it's about a client experience within the program, right? And then, so we are working very hard on setting all these processes so that even if tomorrow I have to scale up, right, to an x by an x number, my processes will not fail. They will be headstrong. So we are definitely working on that. As far as any formal professional and all that, so I think once I have the processes right, then yes, professional expertise can always add value to that. But then if I am bringing in a professional expertise without having my own processes right, then it will be like a trial and error. Every expert will come and try to put in their own processes, and I will see, okay, it's not working in my case because it just does not meet what the intention is.
Great, great. And do you have any mentor or anyone whom you consult with when you want to when you're stuck?
um I won't say any formal mentor as such, but then we the startups that we work with, both me and Ashwini, right? For example, our boss in Forest Health, Dr. Sham. I mean, it is always amazing to meet him and kind of learn from him. Then my boss, my manager, when I was working in Netherlands for the startup, right? Like, whenever I connect with him, it's always a lot of learning and kind of so there's no formal mentorship as such, but then it's always about whenever we connect, there's so much to learn from.
Great, great. Nice. So, and if someone is starting, for example, someone wants to do something in healthcare now. So, what would be your maybe some points that that person should consider, or would help someone who's starting new into anything in healthcare or something similar to yours?
Okay, so one thing definitely is, anything that you're starting, it has to be there has to be a differential aspect. You will need to offer different. When we started off, right, we were one of the early functional medicine clinics. Many others have come in and with varying prices and a lot of add-ons, etc. But then certain basics have to be very obvious in your offering, right? And that's about um, in your communication with the client, that it's a customer first, right? It always has to be the customer first, and then rest everything around that. Similarly, within a company, it always has to be the team first, a team member in the center, and then rest everything around. That's very important, and I think that has been one of our success mantras so far, that we have always considered client first whenever we are dealing with them. We never take we never take a subscription fee from a client unless we have spoken with them. We first speak with them. um, we make them very clear what they are getting into, right? What their expectations can be, and only if both are on the same page, that's when we take a payment. So that helps us a lot, uh, in kind of not having refunds, etc. The expectations are clear. I think that transparency is very important, especially in health, because you may want to offer something, but maybe the client is expecting something else.
So being very transparent from day one is really
Absolutely, it's very very important.
anything from your lessons of managing skilled people like your doctors and a lot of skilled other folks also, right?
Yes.
Managing or hiring, like you already said that you hire the like you have some criterion, but anything that people can be watchful of or uh, some best practice that you follow.
So like I said, we always that I respect time, and there has to be a work life balance. um, but then if in your first interview that candidate is asking what will be the work timings, right? That's something that really turns me off, right? Because you've not even understood what kind of role this is, and you're already asking about what will be the timing, working hours. So I think that's definitely one turn off. I respect time, and I'll definitely abide by that, but that cannot be the first question, what will be the working hours. The other thing is, I we also believe in giving freedom when it comes to taking making treatment plans, or we have to give that liberty, we have to give that leverage to our team, so that they can come up with new ideas. We cannot be just imposing that, okay, you have to make the plan only this way. We have to give them free hand, come up with more ideas, etc., and be open to receiving them. I think that's also very important.
And the one thing that I see is that you saw that there's this niche functional medicine uh, domain that definitely needs to be explored, and you were amongst the first mover over here. So, do you still feel that like someone who's like who's starting like as a bootstrap thing in Medicare, they have to find these niches only, then only they can do bootstrap, or in the regular medicine practice also people can do something online bootstrap or something physical bootstrap as well.
See, it's definitely finding a niche always helps any venture to grow. But then, even if you're just in medical practice, for example, right? Let's say you are a regular doctor, uh, but then you will definitely need to have an edge if you want to kind of make it grow. Um, if you see many startups in the space of where just offering regular online consultation, they are just connecting you with a doctor. Many of such startups have also blossomed, in the last 4 5 years, where they're not doing anything different. It's a regular consultation. They're just connecting you with a gynac or an eye specialist, just as the regular one.
Mhm,
So I think it's all about how you're also kind of packaging what you are trying to offer.
mhm,
Yes, but definitely an edge has to be there. You have to
mhm.
stand out.
Got it. And see, in a business, in a company like yours, the the way your employees, like the way the doctors talk to the patients, and like the way they empathize, because ultimately the person in the front has to also feel like comfortable enough that,
Absolutely.
right?
Yes.
So, and so how do you formally ensure that uh, uh, like, because a lot of times people may be having like because they're working from home, there are 10 things happening in house, and they can always things can always go south, right? So how do you how do you inculcate that culture that at all times this is how the communication should happen, or or like do you have any formal trainings that you do on a regular basis, or what happens?
Yeah, see, our team learns a lot from us, because they join us a lot on our initial calls. So I think a lot of learning for them comes from us. And a lot of the team also reflects a lot, what the founders are. In my opinion, they reflect what, the essence of the work is. So yes, a lot of their learning has been from us. And also, there are certain sets of training that we do. We also kind of, so there are, of course, there are guidelines. You may be working from home, but then it cannot be like they're on a noisy background and you're on a patient call. So of course, we have to respect all that. So there are guidelines and there are trainings on that as well.
Oh, great. So I think I have covered all my questions. Anything that you would like to share, like from your side?
So when we started off, with our venture, of course, our hopes were high, and we really wanted to create an impact, change how things are going in healthcare. Um, yeah, but then we had very humble beginnings. So over the last few years, we had our struggles, and we but then one thing that always kept us going is that we never chased money. It was always that we want to be very good in what we are doing, right? um we should not be running behind money. And that's also something that I would want new founders to also imbibe. Focus, the focus should be on what you can deliver, right? If what you are trying to deliver is amazing, is impactful, you don't have to worry about money. And I
Nice.
think that um, that inspiration has that's something that has always been inspiring us over the last few years. And whatever conversations, partnerships that we have done, collaborations we have done, it was not always about, okay, what we will get out of this. It was about building relationships, it was about doing things together.
Mhm.
And I think that also helped us create this ecosystem where we have now so many partners working with us.
Yes, yes, yes. Nice. Great. So I think we are we are done for today. So I would say that amazing journey, right? Matlab, since I see that there's a great uh, mindset that you have started this whole thing with, and I can see that at every stage you have been very innovative, right? And building things yourself, and like uh, ensuring that you are taking the best out of that moment, because taking that one step, building one organization, then next, and then making sure that you're creating the ecosystem when it is required, right? And a lot of people start with that approach that I'll do everything, and then once they do everything, then they realize I have not really done anything correctly. But in your case, I can see that you have done you have done things when they were required, and that's how things have worked really well. But really amazing to hear bootstrap journey of how you have done it. So thank you again, Ruhi, for joining us today.
Thanks, Shivam, and thanks for the opportunity to share my journey. um, and I think for startups like ours, where we have so many things to do and we cannot have everything in house, we cannot have a team in house to do everything. I think people like you and the team that you have also help startups like us to really excel in whatever we are doing and achieve what, what what we want to do. And I think your
Yeah,
support
so
has been amazing so far.
thank you. I think that's what we, I think what we also try is that because you have great products, right? And we feel that what you're doing is great. So, and a lot of founders, we have observed this, that they have great things, but it's not able to reach the right people just because the technology does not allow the content to reach the right people,
Yes.
right? And we are only trying to make sure that those technological aspects we are able to help the founders navigate so that whatever they are doing right is actually reaching the right people. So hopefully we'll do good as well because this field is changing a lot and
Yeah.
a lot of technology changes happening. But yeah, this is also exciting for us.
Yeah. Thank you.
So
Thank you so
I'll
much.
just